Earlier this week, I said that we are now able to begin the restoration of NHS services. Now that we're past the peak, I can tell you about the next step, the restoration of fertility services. Few families have been untouched by the amazing advances in fertility treatments over the past generation. And I know just how time-sensitive fertility treatment can be and how important it is for the families affected. And I know that this treatment can change lives for the better forever. So when I say thank you to all of you, everybody watching, for staying at home to protect the NHS, of course I'm saying thank you on behalf of the lives that you're saving. But I'm also saying thanks on behalf of the lives that the NHS can now once again help to create. Because together we've protected the NHS and we're now restoring the NHS and restoring the chance for so many couples to start a family. Turning to the figures, 177,454 people have tested positive for coronavirus, an increase of 6,201 since yesterday. 15,111 people are currently in hospital with coronavirus, and 27,510 people have now sadly died across all settings, an increase of 739. As one, we'll remember them and treasure their memories. This is a virus that has a devastating impact on families, on friends, on local communities. And right across government, we're working day and night to defeat it. At the beginning of last month, at this podium, I set a goal that anyone who needs a test should get a test. And that as a nation, we should achieve 100,000 tests per day by the end of the month. I knew that it was an audacious goal, but we needed an audacious goal because testing is so important for getting Britain back on her feet. I can announce that we have met our goal. The number of tests yesterday, on the last day of April, was 122,347. This unprecedented expansion in British testing capability is an incredible achievement, but it is not my achievement. It is a national achievement, achieved by a huge team of people working together. And I tell you this, the testing capacity that we've built together will help every single person in this country. Testing is crucial to suppress the virus. I know from personal experience too, just how much people with symptoms want to know if they've got the disease. I know that I did. It helps remove the worry, it helps keep people safe, and it will help us to unlock the lockdown. So many people have tragically died, and the challenge that we still face is vast, but we're making real progress. I want to take a moment to thank and pay tribute to the incredible team who did this together and who joined in one of the greatest national mobilisations that we've seen. We brought together the best civil servants, the best minds from the private sector, the best scientists, the best lab technicians, and the best of the best in the armed forces. Setting stretching, ambitious goals in a crisis has a galvanising effect on everybody involved. It is a mission. If we hadn't been so bold, if we'd chosen a safer, easier path, I just can't see how we would have built the capacity that we need. In a few short weeks, we've created a new test for the virus in PHE. We've built a network of regional testing centres. We've put a fleet of mobile testing units on the road and created home testing kits. So if you can't get to the test, we can get the test to you. We've more than doubled the capacity of NHS and Public Health England labs and created 3 brand new mega labs to analyse the results. So many people have played a part in this work. British diagnostic companies like Randox and Oxford Nanopore and Medical Wire and DNA Nudge and Samba, logistic companies like the Royal Mail and Yodel, who were brilliant and got us out of a real hole this week, academics like Professor Derek Crook and Sir John Bell from Oxford and Professor Aradazai from Imperial, Deloitte and Boots, who've delivered our drive-through centres, AstraZeneca, GSK, Novocyte, whose labs go on stream next week, Public Health England and the NHS, of course, who've pulled out all the stops, Professor Sharon Peacock, Professor John Newton, and the UK Biocentre and the CRIC, who set up high-tech laboratories. And also, it wasn't just a national effort. People from across the world, including Thermo Fisher, Hologic, Abbott, and Amazon from the US, QIAGEN from Germany, and Roche from Switzerland. And this is how we did it, because everybody worked together with grit and determination to reach a shared goal. And they thrived because the team contained diversity of perspectives, of backgrounds, and critically, a diversity of thought. And when things went wrong, which they did every single day, believe me, we didn't ask who we could blame. We asked how we could fix it. So to my team, I want to say you toiled tirelessly, night and day, and I'm so proud of what you have achieved. And to all of you, on behalf of government, on behalf of the whole country, thank you. As the Prime Minister said, a big increase in testing provides a way to unlock the puzzle of coronavirus. And testing forms the first element of our plan to test, track and trace. By mid-May, we'll have an initial 18,000 contact tracers in place. That work is underway as we speak, and if it needs to be bigger, we'll scale it as required. The combination of contact tracers and new technology through our new COVID-19 NHS app will help tell us where the virus is spreading and help everyone to control new infections. People will be able to know if they've been in close contact with someone who's transmitting the disease and take the action that they need to. Our full-scale test, track and trace model will drive the infection rate down, and the lower the R and the lower number of new infections, the more effective the track and trace system will be. Tracking and tracing will allow us to get R down and hold R down. And so it will allow us to lift lockdown measures. Now, this disease affects us all indiscriminately. We've seen that. In recent weeks, we've had to impinge on historic liberties to protect our NHS and our loved ones. And yet our goal must be freedom. Freedom from the virus, yes, and we will not lift measures until it is safe to do so. But also, we care about the restoration of social freedom and economic freedom too. Each citizen's right to do as they please. For now, we're working together to stay home. We're impinging on the freedom of all for the safety of all. With this next mission of test, track and trace, I'm seeking a solution that allows us, by each of us participating, to target the measures that are needed with much more precision. And so to reassert, as much as is safely possible, the liberty of us all. That is our next mission. But for now, the most important thing for everyone to do, to keep R down and to get us all through this, is to maintain the spirit and the resolve that's had such an impact thus far. So please, stay at home, protect the NHS, and save lives.